Welcome to today's video where we'll be discussing a common digestive ailment, constipation. We'll explore its causes, symptoms, diagnosis, and most importantly, how to manage and prevent it. So, what causes constipation? The etiological factors are diverse. Often it's linked to dietary habits, particularly a lack of fiber and insufficient fluid intake. Certain medications, such as opioids, antidepressants, and iron supplements, can also contribute. Lifestyle factors like inactivity and ignoring the urge to defecate play a significant role. Underlying medical conditions, including irritable bowel syndrome (IBS), hypothyroidism, and neurological disorders, can also lead to constipation. In some cases, structural problems within the colon or rectum may be the culprit. Furthermore, changes in routine, such as travel and even pregnancy, can disrupt bowel regularity. Let's delve into the pathophysiology. Constipation occurs when stool moves too slowly through the digestive tract, allowing the colon to absorb excessive water. This results in hard, dry stools that are difficult to pass. This slow movement can be caused by decreased intestinal motility, which is the rhythmic contractions that propel food along. Problems with the pelvic floor muscles, which support the rectum and anus, can also contribute to difficulty evacuating stool. Nerve damage or dysfunction can disrupt the signals between the brain and the colon, further impairing motility. The gut microbiome can also influence bowel habits. Imbalances can lead to altered stool consistency and frequency. Constipation is a very common condition, affecting people of all ages and backgrounds. Epidemiological studies show that women are more likely to experience constipation than men. The prevalence increases with age, affecting a significant portion of the elderly population. Certain ethnic groups may also have a higher predisposition. While often a temporary inconvenience, chronic constipation can significantly impact quality of life and healthcare utilization. It is important to note that people from all over the world, regardless of cultural backgrounds, can experience constipation. The signs and symptoms of constipation can vary from person to person. The most common symptom is infrequent bowel movements, typically defined as fewer than 3 bowel movements per week. Stools are often hard, dry, and difficult to pass. This can lead to straining during defecation and a feeling of incomplete evacuation. Other symptoms may include abdominal bloating, pain, and cramping. Some individuals may experience nausea, loss of appetite, and even headaches. Severe constipation can lead to complications such as hemorrhoids, anal fissures, and fecal impaction. Diagnosing constipation usually begins with a thorough medical history and physical examination. Your doctor will ask about your bowel habits, diet, medications, and any underlying medical conditions. A digital rectal exam may be performed to assess for any abnormalities. In some cases, further testing may be necessary. These tests may include blood tests to check for thyroid problems or electrolyte imbalances. A colonoscopy or sigmoidoscopy may be performed to examine the colon and rectum for structural problems, and a rectal manometry can assess the function of the pelvic floor muscles. A stool test can be done to look for infections or inflammation. Barium minimus and abdominal X-rays are less common but still used in certain situations. Constipation can be classified into different types depending on the underlying cause. Functional constipation is the most common type and is characterized by constipation without any identifiable underlying medical condition. Slow transit constipation occurs when the colon contracts more slowly than normal, leading to infrequent bowel movements. Outlet dysfunction constipation, also known as dysenergic defecation, is characterized by difficulty coordinating the muscles needed to evacuate stool. Secondary constipation is caused by an underlying medical condition or medication. Irritable bowel syndrome with constipation, IBS-C, is a subtype of IBS where constipation is the predominant symptom. Treatment and management of constipation typically involves a multifaceted approach. Lifestyle modifications are crucial, including increasing fiber intake through fruits, vegetables, and whole grains. Aim for at least 25-30 grams of fiber per day. Adequate hydration is also essential, so drink plenty of water. Regular exercise can help stimulate bowel movements. Over-the-counter laxatives, such as bulk-forming agents, stool softeners, osmotic laxatives, and stimulant laxatives, can provide relief. However, stimulant laxatives should be used sparingly as they can lead to dependence. Prescription medications, such as chloride channel activators and guanylate cyclase C agonists, may be necessary for chronic constipation that doesn't respond to other treatments. Biofeedback therapy can help improve pelvic floor muscle coordination. In rare cases, surgery may be necessary to correct structural problems. Preventing constipation involves adopting healthy lifestyle habits. Eat a high-fiber diet rich in fruits, vegetables, and whole grains. Drink plenty of water throughout the day. Engage in regular physical activity. Don't ignore the urge to defecate. Manage stress through relaxation techniques like yoga or meditation. Be mindful of medications that can cause constipation and discuss alternatives with your doctor if possible. Establishing a regular bowel routine can also be helpful. Probiotics may also contribute in a positive way to have healthy bowel movements. The prognosis for constipation is generally good, especially with appropriate treatment and lifestyle modifications. Most individuals can manage their symptoms effectively. However, chronic constipation can significantly impact quality of life and may require ongoing management. Recent research has focused on the role of the gut microbiome in constipation and the development of novel therapies targeting specific gut bacteria. There is also ongoing research into the effectiveness of biofeedback therapy for outlet dysfunction constipation. Advances in diagnostic techniques, such as high-resolution and erectile manometry, are improving our understanding of the underlying causes of constipation and leading to more targeted treatments. More research is underway to better understand the impact of constipation on the colon.